Good morning, everyone. Today's discussion focuses on a pivotal study published in a Journal of Thrombosis and Thrombolysis in 2023, which examined the long-term risk of venous thromboembolism (VTE) in patients who have recovered from COVID-19, conducted by Soin et al. This systematic review and meta-analysis assess the incidence of conditions like pulmonary embolism (PE), deep vein thrombosis (DVT) across large population. The study provides crucial insight into how these risks persist beyond the acute phase, offering valuable information for enhancing patient care and long-term outcome. The study aimed to assess the long-term risk of venous thromboembolism (VTE), specifically pulmonary embolism (PE) and deep vein thrombosis (DVT) in patients who have recovered from COVID-19. It seeks to quantify these risks and identify key factors that influences VTE incidences during the post-recovery phases such as age and gender. This research is crucial for guiding decisions on extended monitoring and preventative care for COVID-19 survivors. What has been done before? Many previous studies have extensively researched the occurrence of VTE, including DVT and PE, during acute phase of COVID-19. These studies have demonstrated that patients are particularly prone to clotting complications due to factors such as immobility, inflammation, and hypercoagulable state induced by the virus. The findings from randomized clinical trials have informed clinical guidelines, particularly the use of anticoagulation therapy to mitigate these risks. However, there have been much less research focused on the occurrence of DVT and other thrombolytic events in post-recovery phase, leaving a significant gap that current study seeks to address. The importance of the study. This study is important because it addresses a critical gap in the understanding of long-term cardiovascular risk associated with COVID-19, particularly VTE. While much research has focused on acute phase, far less is known about how these risks persist after recovery. The study provides essential insight into ongoing risk of conditions like PE and DVT in COVID-19 survivors, which are crucial for guiding post-recovery care and improving long-term patient outcome. Let us look at the relevance to ICU patients and the public. The ICU patients, especially those with the severe COVID-19, are high-risk category for complications like VTE. With the increasing number of survivors, it's crucial to understand long-term risk and complications they face, ensuring they receive appropriate care post-recovery. Again, this study underscores the importance of ongoing venous thromboembolism monitoring after ICU discharge, as the risk persists well beyond the acute phase of COVID-19. For healthcare providers, the research offers valuable insight into long-term risks that COVID-19 survivors may face. It highlights the critical need for heightened awareness and monitoring of VTE, particularly in COVID-19 patients who have been in ICU, ensuring that these patients receive necessary care to prevent serious complications. This study has significant implication for ICU settings, providing valuable data that can inform the development of evidence-based protocol to manage ongoing risk of venous thromboembolism in COVID-19 recovered patients. ICU patients are at a highly elevated risk for thromboembolic event due to factors like immobility and sedation. The insights from this study are crucial for creating tailored prevention strategies that can improve patient outcome in ICU, ensuring that these high-risk patients receive best possible care. Finally, this study provides critical guidance for post-discharge care, particularly in the continued use of thromboprophylaxis for COVID-19 recovered patients. The findings support the creation of care protocol aimed at reducing the risk of venous thromboembolism in these patients, which is crucial for ICU care planning. By implementing evidence-based strategies, health care providers can better manage long-term risk faced by COVID-19 survivors, ultimately contributing to improved patient outcome and prevention strategies. Summary of the study. This study was designed as a systematic review and meta-analysis following PRISMA guideline to assess the long-term risk of venous thromboembolism in COVID-19 recovered patients. Data were sourced from Medline and Scopus, including studies published up to September 1, 2022. The analysis covered a large population of over 20 million patients, with more than 2 million having a history of COVID-19. The primary outcome measures were the incidence and risk of pulmonary embolism and deep vein thrombosis in patients. Statistical methods include use of random effect models to calculate pooled incidence rate and hazard ratio, while meta-regression was performed to examine the influence of factors like age and gender on VTE risk. To ensure the robustness of the finding, bias reduction techniques such as Newcastle-Ottawa scale for quality assessment were employed. Heterogeneity was addressed through meta-regression and random effect modeling, and population bias was minimized by including a broad and diverse patient cohort, ensuring that the results are both reliable and applicable to clinical practice. Table 1 and 2 shows the influence of age and gender on VTE risk, meta-regression, effect of follow-up length on VTE risk. Table 3 shows factors influencing VTE risk, again meta-regression analysis. Table 4 is sensitivity analysis. The study outcomes. Study evaluated the incidence and risk of VTE including PE and DVT in COVID recovered patient. The results showed a significantly higher risk of both PE and DVT, with the hazard ratio indicating more than a 3-fold increase for PE and over a 2-fold increase for DVT compared to non-infected individuals. These findings are clinically important as they highlight the ongoing risk of life-threatening thrombolytic events, emphasizing the need for extended monitoring and potentially prolonged thromboprophylaxis to improve long-term patient outcome. Clinically important outcomes for the study. The study highlights that PE and DVTs are serious life-threatening conditions that can lead to significant morbidity and mortality in COVID-19 recovered patients. These outcomes are crucial as they directly influence clinical practice, guiding the monitoring, prevention, and treatment strategies such as the use of thromboprophylaxis. Effective management of these conditions is essential to prevent severe complications underscoring the importance of addressing these risks in COVID-19 survivors. Why this study is important? This study is important because it addresses a critical gap in the understanding of long-term cardiovascular risk associated with COVID-19, particularly VTE, while much research has focused on acute phase, far less is known about how these risks persist after recovery. The study provides an insight into ongoing risk of conditions like PE and DVT in COVID-19 survivors, which are crucial for guiding post-recovery care and improving long-term patient outcome. In critically appraising this study, it is important to recognize both its strengths and limitations. The study's large sample size and systematic approach significantly enhance the validity and generalizability of its finding. By using a systematic review and meta-analysis, the researchers were able to provide a comprehensive assessment of VTE risk in COVID-19 survivors. However, there are key limitations to consider. The high heterogeneity among the included studies suggests variability that could affect the consistency of the result. Additionally, the observational nature of the study means that while association can be identified, causality cannot be definitely established. Potential bias such as publication bias, selection bias could also influence the finding, especially since the study relies on existing literature which may not fully capture all relevant data. Despite these limitations, the study makes a significant contribution to our understanding of long-term risk of VT in COVID-19 survivors. It provides a crucial data that can inform clinical guidelines, emphasizing the need for extended monitoring and preventative strategies to improve patient outcomes. However, healthcare providers should interpret the result with caution, considering the inherent limitation of the study design. The study's impact on clinical practice. This study has a profound impact on clinical practice by highlighting the increased risk of VTE in COVID-19 survivors, including PE and DVT. These findings emphasize the need for healthcare providers to implement extended monitoring and consider prolonged thromboprophylaxis for high-risk patients. Integrating these insights into clinical protocol can help prevent severe complications and improve long-term outcome of patients recovering from COVID-19. Applicability of this study to the wider population. This study is highly applicable to the wider population, particularly for COVID-19 survivors who remains at elevated risk of VTE, including PE and DVT. For our journal club, this research provides a valuable basis for discussing how these findings can influence clinical guidelines and improve long-term care strategies. It encourages us to consider the need for extended monitoring and preventative measures across diverse patient groups, ensuring better patient outcome for all COVID-19 survivors. Finally, in conclusion, after reviewing this study, I am convinced that its findings are crucial for informing my practice. The increased risk of VTE in COVID-19 survivors, particularly PE and DVT, underscore the need for extended monitoring and preventative measures in patient care. I will incorporate these insights into my clinical practice by advocating for prolonged thromboprophylaxis and more rigorous follow-up protocols for high-risk patients. This approach will help ensure that COVID-19 survivors receive the comprehensive care they need to prevent severe complications and improve their long-term outcome.